Hi, I'm Waukesha Horn, the Quality Assurance Director and Complaint Intake Supervisor for the Division of Healthcare Facilities, Long-Term Care Division. I will be speaking with you briefly this morning regarding F880, specifically regarding the blood glucometer device. There's been numerous documented cases of transmission of hepatitis B from improperly using the blood glucose meter. These instances have been investigated and reported by the CDC. The CDC, along with the FDA, have recommended that since 1990 that the finger stick devices be used restricted to individual use. But in the case when they are used for multi-use residents, that those devices be cleaned and disinfected between use. With respect to disinfecting the individual blood glucose meter, the State Operations Manual clearly states that resident care devices, including the glucose monitoring device, may transmit pathogens. If that device is contaminated with blood or bodily fluids, if it's shared without cleaning and disinfecting for different residents. So I'll be speaking with you regarding F80. F80 states the facility must establish and maintain an infection prevention and control program designed to provide a safe, sanitary, and comfortable environment and to help prevent the development and the transmission of communicable diseases and infections. With regards to the blood glucose meter, it must be cleaned and disinfected after each use according to the manufacturer's instructions for multi-resident use. The staff cannot carry these blood glucose meters in their pockets, and those that are dedicated to one person still must be handled in a way to ensure that there's no cross-contamination. Let's give you a few definitions here. What is cleaning? Cleaning is the removal of germs, dirt, and other impurities from surfaces or objects. Cleaning can work by using soap or any type of detergent and water. When we're speaking of disinfecting, that's killing of germs on the surface or objects, and that's with using a chemical agent. The FDA has released guidance for manufacturers regarding appropriate products and procedures for the cleaning and disinfecting of the glucometer meters. We have included here the link to the FDA's information regarding those cleaning and disinfecting agents. If the manufacturer is unable to provide information on how the blood glucometer meter should be cleaned and disinfected, then the meter should not be used for multiple residents. If the facility has failed to clean and disinfect per the manufacturer's instructions, and the meters are being used on more than one resident, we must cite this tag and utilize the guidance in Appendix Q as it may constitute immediate jeopardy. And the key word there is as it may constitute immediate jeopardy. Not all cases would be immediate jeopardy. Not every time the staff fails to clean and disinfect the glucose meter will it be immediate jeopardy. We've dedicated some time in speaking with the CMS, our representatives in our regional office, and have determined things as to when we will cite immediate jeopardy and when we will not. When it's not immediate jeopardy, the team has to be able to look at the facility's policies and procedures for use, and it should include how they're going to clean and disinfect the glucometers. Their policy should reflect the position of the CDC, and it should be current with the acceptable CDC standards. There has to be documentation also that the nurses have received education on the fact that the glucometer can be a transmission source of hepatitis B, and they must be disinfected after each use. That specific instruction should basically be able to say how the facility is going to accomplish this task. The facility also has appropriate manufacturer's instructional booklet, and the staff is following those procedures for cleaning and disinfecting. So if you are the surveyor and you are watching medication administration and they are performing the finger stick blood sugars, please make sure that we document basically what's going on, what type of meter that is being used, how the staff is cleaning and disinfecting, and what agents that they are using. Cleaning supplies also is not immediate jeopardy when the facility has the cleaning supplies consisting of the EPA registered disinfectant, and that has to be effective against HIV and hepatitis B. The manufacturer's information sheet is available for the cleaning agent, and the staff is following that information prescribed in that brochure on how to, what's the contact time and what agents that cleaning agent would be able to kill. And it has to be able to kill Hep B. There's also documentation of supervisory observations of the nurses performing the finger stick blood sugars. So it's not just feasible for the facility to say that they provided education and the nurses are doing it, but they've got to be able to show where they are monitoring the nurses to make sure that their policies and procedures are being implemented. Also, in cases when it's not immediate jeopardy, the nurses can tell the surveyor what the facility's policy is on cleaning and disinfecting, and that also there's been no prior resident is not one to have active HIV, hepatitis B, Hep C, or that resident is not on any isolation for a potentially transmittable disease. All other infection control processes and procedures are also being followed. That is hand hygiene, glove use, where they're disposing of the lancets, any type of sterile technique for the finger stick blood sugar, and all of the equipment is disposed of properly. When is it IJ? Because we've listened to, and I've spoke of when it's not IJ, but when is it IJ? These are instances where the state agency, the Alabama State Survey Agency, has cited the facility for not infection control process related to the blood glucose meter. In this case here, we've had observations, and that's going to be our key piece of evidence there, the observations of what we observed the licensed staff doing while we're in the facility related to the finger stick blood sugar process. We have our interviews, we've reviewed the facility's policy, as well as the manufacturer's information for the blood glucose meter that the facility is currently using. That information should be readily available in the facility because they should make sure that it's readily available and it's also part of their policies and procedure. In this case here, the facility failed to follow acceptable cleaning and disinfecting procedures. We had a licensed nurse. She didn't disinfect the multi-use glucometer. And the key word there is multi-use. We want to make sure when you're interviewing the staff and when you're making your observations of how many glucometers are on that medication cart, and making sure that that staff is using, if you're saying that she didn't clean and disinfect between use, please make sure that that's the only one that she has on the cart, or if she has another, please make sure we document, or when you're interviewing as well, how many glucometers are on the med cart. So this nurse here, she failed to disinfect the glucometer after she had obtained a finger stick blood sugar for a particular resident, R number 66 on 5/23/18. While the facility's policy indicated the multi-use glucometer should be cleaned and disinfected, interviews with the licensed staff, including the director of nursing, the assistant director of nursing, who is also the infection control nurse, and the staff development person who provides the training of staff, they had stated that they had only trained their staff to clean and disinfect it with a 70% isopropyl alcohol prep pad. According to the manufacturer's recommendation, this 70% isopropyl alcohol prep pad was not indicated to be used to effectively against HIV, Hep C, and Hep B. The guidance further indicated that it was not effective against those viral bloodborne pathogens. The facility's manufacturer's information provided by the survey team while they were on site documented to disinfect the meter using the following procedures. Use a fresh super sandy cloth, and it also stated to squeeze out any excess, to disinfect it by gently wiping the front, back, and sides of the meter 3 times horizontally and 3 times vertically. This deficient practice here affected R number 66, and it placed this resident as well as the remaining 22 residents in the facility who received fingerstick blood sugar monitoring in immediate jeopardy. That's one example. Another example is where the facility failed to ensure the nursing staff cleaned and disinfected. And here we're speaking of as well, they're failing to clean and disinfect. So it's not just the cleaning, it's disinfecting as well. And it's also making sure that we say it is a multi-use blood glucose meter. In this instance here, it was between 2 residents, and it had a potential to affect all of the 17 residents in the facility identified as receiving fingerstick blood sugars. And in this case here, a CNA was observed performing the AccuCheck for R number 23 and 34. Each time, the CNA obtained the uncovered Quinette AC glucometer out of the large black cloth carrying case that resembled a tackle box. It was labeled A-Hall. She quickly wiped the glucometer with the wipe she had obtained from the container labeled PDI Sandy Cloth Plus, had the red top on it. And once you're in the facility, you will know that these different color tops mean different things. And so it will say whether it's effective against HIV, HPV, Hep C. So the different color tops, off top of my memory, I think we've seen red, orange, purple, blue. So just make sure that you are aware that the different tops mean different things. The CNA did not allow the glucometer, without allowing the glucometer to dry, she dropped it back into the carrying case and entered the resident's room. When she completed the AccuCheck, she quickly wiped the glucometer and she put it back in the carrying case. She did not correctly clean and disinfect the glucometer prior to and after performing the AccuCheck. They interviewed her immediately afterwards. She had been observed doing the AccuCheck for R number 34. She stated that she didn't clean and disinfect the glucometer before usage. She also confirmed that there was only 1 glucometer in the carrying case that was being used on multiple residents. She also stated that she was the only staff member performing the AccuChecks for the entire facility on the 3 to 11 shift. And so that would basically be able to let the reader know we didn't have to go and observe other staff members because she's the only one that's doing them in the facility on that shift. Now, maybe somebody different for another shift, but making sure that we observed the person that was performing them on her shift, in which was that particular CNA. We also reviewed the product information for the glucometer that was being used by the facility, and it recommended Cavi wipes. However, the facility did not use those recommended germicidal wipes. Instead, they used that PDI Sandy Cloth Plus. We reviewed the information for the PDI Sandy Cloth Plus that the facility was using, and it stated to treat the surface, it must remain visibly wet for a full 3 minutes. And notice in the previous slide, or previous 2 slides, that we talked about how she wiped it in a hurry. She didn't allow it to dry. It also says that you're supposed to use that second wipe to thoroughly wet it, and it's supposed to for 2 minutes and allow it to dry. This was not done. And also, that PDI cloth revealed that it was only effective against C. diff. Interview with the CNA stated that she performed this afternoon's AccuCheck for rooms R200, who was on contact isolation for C. diff. She also confirmed that she used the Sandy Cloth Plus to wipe the glucometer. When asked about her training she had received prior to performing the AccuCheck, she stated that she had received training about 2 to 3 months ago, but she could not recall what she had learned. We did look at her CNA personnel file, training file, which indicated she had not received any training on the use for the use and the maintenance of the glucometer. We also discovered during the investigation process that the facility's policy did not address and or include the manufacturer's instructions on how to clean the blood glucose meter. And also, the facility failed to review and revise their policy to make sure that it did include that information and that it was current with the CDC acceptable standards. The facility's policy did not take into account how to protect other residents from viral bloodborne pathogens, since their current standards indicated for what they were using was not effective against, it was only effective against C. diff. The lack of identification, the lack of action, policy revision put all the residents who receive finger stick blood sugar monitoring with this shared device at risk. The next couple slides talks about the interviews with the infection control nurses as to how they go about training the staff and how they monitor the staff to make sure that those things are being implemented. It's more than just, and I can't say this enough, it's more than just looking at the education sign-in sheets to see. It's the staff that's responsible need to make sure that there is some sort of monitoring and oversight to make sure those learned topics or taught topics are being implemented throughout the facility. As part of our investigative procedure, what we will do during our medication pass observation, and this is primarily for the surveyors, the nurse surveyors on the team that are going to be observing MedPass, but also for the non-nursing surveyors, it's just to make sure that you are aware of what should be done. So therefore, when you all are discussing what deficient practice you have, please make sure that even though you may not be the nurse that can observe MedPass, you should be able still to observe and be able to have input as to whether or not it's deficient practice. So make sure that your documentation, that you document date and time when it was observed, the staff's name as to who you watch perform the finger stick blood sugar, along with their title, resident's name, because that's very key, because we need to be able to identify which residents were affected by the deficient practice. It's very important that we document the type of glucometer used, how many glucometers was on the Met cart. So along with when we're interviewing, we're asking how many, make sure that we have corroborated that information by observing what's on the medication cart. Also, to observe and document the type, which is the name of the cleaner and disinfectant that's present on the Met cart. Some staff, I know also, if you're having concerns, they, even if you say, in cases we've had them to give us a copy of, in one case here we had where the staff was using the 70% isopropyl alcohol prep pad, we end up getting a copy, or they actually gave us one of the prep pads so that we can have in the survey file to say this is what the staff was using. Interview the staff members involved, found out how long they've been employed with the facility, what type of training that they have received on cleaning and disinfecting. And it's not just the current training, because most places will say, well, I had training last night. Well, if you observed the deficient practice yesterday afternoon, that's fine to train your staff after, but we're looking for what training has occurred prior to. How many residents did he or she, that's the licensed staff, provide blood glucose monitoring testing on? Ask them what is cleaning and disinfecting, because we have found in some cases there has been the licensed staff not aware that cleaning and disinfecting are two totally different things. Ask about any residents that have any kind of communicable disease. Also, how many glucometers on the Met cart. From the record review, this is where we're looking at the manufacturer's instructional booklet, which should be readily available in the facility. We're looking at the facility's policies on blood glucose meters. And we're in that policy, it's not just asking for a copy of the policy, it's making sure that we review it to make sure that it's current with CDC standards for cleaning and disinfecting. we're looking at for the staff training, the last staff training prior to the time that in which we're in the facility, and the number of residents ordered to receive blood glucose monitoring, to include their diagnosis as well. Okay, that's it for this presentation regarding blood glucose meters. And we just want to make sure that when you're out there and you observe a med pass, and if you are observing staff performing finger stick blood sugars, please make sure that if that glucometer is being used on multiple residents, that the staff, licensed staff that we're observing, and or it could be the direct care staff, it's who all the facility labels as someone that can perform it, that they are cleaning and disinfecting between use, and making sure that they are following those procedures that set out in their policy, as well as the manufacturer's recommendation. If it's not, then we need to be probing further to find out possibly why and reasons that this may constitute immediate jeopardy. And also, when you have this issue and you feel as though it is immediate jeopardy, those things that we talked about that I referenced as to interviews and observations and the records to review, please make sure that prior to you calling the supervisor to inform him or her that you have possible deficient practice, that you're able to answer those initial questions that have been on the previous slides regarding what observations you've done, what interviews you've conducted, and what records you have reviewed. So please make sure that we have done those initial things before notifying the office of a potential problem. If you have further questions and or comments regarding this topic, please consult your immediate supervisor, and or I always have an open door policy, and refer back to the regulations, because that's also what we're looking back at when we talk with teams as to what deficient practice is or is not. There's also a there is a CE pathway in the long-term care survey process that's regarding infection control, and also it's also discussed in the medication pass observation. Again, thank you. If questions or comments, please let us know, because we want to make sure that we are being able to determine whether or not non-compliance exists at F880. Thank you.